Good day, everyone. This is Dr. Chung from Hong Kong. Thank you for the opportunities to present our work. Today, I'm excited to share our recent study exploring the applications of artificial intelligence in wheelchair fencing classifications. To give a brief background, wheelchair fencing is a Paralympic sport where athletes compete on the wheelchair that are securely fixed onto the platform. Because the chairs are immobilized, an athlete's performance relied heavily on their trunk control, balance, and upper limb function. Currently, classifications is conducted by panels of 2 to 3 classifiers who evaluate the athlete's medical history and conduct a physical assessment. Athletes must meet at least one minimal impairment criterion, such as impaired muscle power, hypertonia, or restricted range of motion. Based on this, they are grouped functionally into Category A, fencers who have good trunk control and balance. Category B, fencers who have poor trunk control. And the Category C, fencers who have weak trunk and impaired upper limbs. While this classification system is well established and has been recently refined, it still inherently relies on the degree of subjective human judgment. Because of this, we saw a critical need to explore whether objective technologies could assist and enhance the classifications process. Our objective was straightforward. We want to develop a machine learning algorithm capable of accurately distinguish between Category A and Category B wheelchair fencers using purely objective biomechanical data. To achieve this, we recruited a total of 15 fencers. For the training phase, we used data from 4 Category A and 4 Category B fencers. For the testing phase, we evaluate 5 Category A and 2 Category B fencers. In these studies, we utilize a TechSkin confirmed pressure mat sensor system. This mat consists approximately 2,000 sensing elements, and it captures seated pressure data at 60 Hz. Each participant performs standardized classification-related trunk tasks for 15 times. This included upper back extension, bilateral side balance test, lower back extension, and side balance with weapons while holding and without holding the armrests. These tasks were directly derived from international wheelchair fencing classification procedures and are specifically designed to evaluate trunk control and stability. From the pressure map data, we extract 5 distinct categories of features. They include first, basic pressure features that measures peak pressures and centers of mass. Second, the distribution enhanced features for looking at total contact area. Third, the quadrant-based features for assessing left, right, and anterior posterior ratios. Fourth, we have the stability features for checking the velocity and deviations of the centers of the pressure. Fifth, we also have shape and contour features for evaluation the pressure concentration thresholds. Ultimately, extracting these specific features allow us to capture not just how much force was applied by the athlete, but exactly how the pressure was distributed. Furthermore, we could capture how stable their trunk remained during dynamic movement. Moving on to the modeling phase, we implement and compare 3 recurrent neural network architectures. Our model utilized dropout for regularizations and sequential linear layer with VLU activations. The final layer performed a binary classifications between category A and category B, utilizing a threshold of 0.5. Our training process rigorously including batch processing, feature selections, and continuous monitoring of both training and validations logs. So, what did we find? Our results were highly encouraging. First, the GRU model performed the best, achieving an overall accuracy of 3.6% across all participants and all actions. We found that distribution-based features consistently showed the strongest performance. Interestingly, the high accuracy for single actions were observed during the lower back extension, hitting an expressive value of 96.7 accuracy. When looking at individual participants, the highest accuracy reached 98.8%, particularly when using distribution gradient features. In our validation trials, model based on pressure distribution achieved an accuracy of over 78.8%. Together, these results strongly suggested that seat pressure distribution patterns are highly informative for distinguish between category A and category B fences. To the best of our knowledge, this study represents the very first proof of concept study applying assisted technology and machine learning directly to wheelchair fencing classifications. Our findings clearly indicate that objective biomechanical data can meaningfully differentiate functional classes. We proved that distribution-based pressure features are particularly powerful, and we identify lower back extension as a highly discriminative task for future classifications purposes. However, as with any proof of concept, we must acknowledge a few limitations. In these studies, our sample size was relatively small. Besides, the pressure map is not variable, meaning it may shift slightly during testing, which will affecting its accuracy. Also, differences in an athlete's skill level or training background may influence their trunk control independently of their impairments. Last, perhaps one of the most particular issues, we did not collect data during live competitions. These factors mean we must be cautious regarding the generalizabilities of the data at this stage. In conclusions, we have successfully demonstrated the feasibility of a machine learning assisted tool for wheelchair fencing classifications. While preliminary, this finding paved the way for future research utilizing larger sample size, variable sensors, and the integrations of additional biomechanical measures. Ultimately, we believe that technology-assisted classifications has the tremendous potentials to enhance the objectivities, consistency, and fairness in Paralympic sport. Thank you.